So these are challenging times, and we've got a little lead time, and you know what, the provinces should not shy away. I know Ontario's shying away. Ontario's shying away from everything. In Ontario, we've gone from a have to a have-not, and you know, soon to be a have-nothing province if we keep going the way they're going. So I think other provinces, BC, Alberta, they're willing to take up the task and say, yeah, we've got to respond. We've got to do more things more effectively, more efficiently, more innovatively. And this kind of, you know, it's like giving somebody a blank check continually. They're not going to do anything. They're going to sit and they're going to say, same old, same old.
Any examples?
We're not going to do anything. We're not going to innovate. But when you say, you know what, you've got 4 or 5 years, you've got to start doing things a little differently, a little more efficiently, so that we can maximize our resources. Then they start to think. Then other things kick in. Innovative things kick in, and innovative methods are developed. And don't ask me specifically, Dave, what they are.
You're saying Alberta knows what it's doing and sees the light, so I'm just trying to get an example.
Okay.
Other than having a whole lot of money from oil to do what they're doing, what are they doing?
They're doing healthcare more innovatively.
How?
They're utilizing the private sector more innovatively.
In what ways?
I don't know. I'm not a healthcare professional. I know they're doing that.
All right.
You know,
So how did you come to this opinion if you don't know? How did you come to this opinion if you don't know?
because that's what's reported. That's what's reported. I'm not a doctor. I'm not a pediatrician. I'm not a healthcare professional. I do know from a broad sense that that's what's happening, because that's essentially what Alberta's been trying to do for years. They've been trying to go this route, and they've been to a degree handicapped.
Why would?
Hmm?
What were they handicapped by?
So they've been stymied by other provinces not wanting to go that way.
Being Canada helped that?
Yeah,
Are you going to change the Canada Health then?
I'm not going to do anything. Our government's probably looking at ways and means of providing that flexibility within that framework. But I'm not the Minister of Health.
So going back,
It's all good. It's very positive.
so just going back to that, reassuring the public that when you talk private sector and healthcare, that you're not saying you're privatizing healthcare, because
No, not in the least. And I want to make that perfectly clear, Kate, and I'm sure our government does as well. I support public health care, okay? Provinces and the federal government. Because I don't want to get into a situation like the United States. I'm far from that. That's not the route we need to go. We need to have our cake and eat it, and we can't have our cake and eat it with our system, because our system is ingrained in public service. But having said that, that doesn't mean we just have to, you know, rest on our laurels and propagate inefficiency. We need to utilize the private sector to develop those efficiencies that can be used with the public sector in charge. A private sector healthcare system. It's a public sector system utilizing the efficiencies from the private sector.
Got it.
Got
Public
it?
health delivered by private enterprise.
No, that's not it at all. Not it at all. You can spin it any way you want it, but
Well, I just try to
it's not.
see where the rubber hits the road here.
It's not. It's always the public sector in charge, because we don't want our health care dictated by the dollar. What we want to do is we want our health care dictated by the public sector, so we're all in charge. But we want to get the most efficient equipment possible. We want to get the most efficient system. Look at, for example, look at our system in the past with regard to records, public records. Dr. Wendy Stewart in North Bay is developing a wonderful business based on keeping individual records. Right now, it's archaic and it costs a lot of money. With electronics these days and the electronic field and computers, we can develop a much better system that would cost a lot less money. And you know what? The governments are still in charge of healthcare. Maybe that's your example. Maybe that's an example locally that I can cite you. You know? And it doesn't cost a lot of money on information systems and duplication of systems and systems that don't work and systems that are archaic. Systems are very efficient.
This past summer, Minister Clement was handed the job of finding cuts to the government budget. I think it was 5% per ministry in an agency. What are we going to start seeing that those cuts roll out?
You're going to see that, Rob, in terms of consultations that are rolling out beginning of the new year. And, you know, Minister Clement may in fact have a consultation process in North Bay. I think they're working on it. And what he wants is input from MPs. He wants input from all Canadians. How can we do better? How can we make our system more efficient? And specifically, it's called the DRAP. The acronym is DRAP, Deficit Reduction Action Plan. And basically, it's tell us where inefficiencies lie. Tell us where we can be more efficient. The public service and all the departments, all 64 departments and agencies have been asked for, give us a scenario where you've got 5% cut, give us a scenario where you've got a 10% cut. Because, you know, as a government, I mean, we can't ask for all this belt tightening if we're not tightening our own belts. Our own belts start with us, so that's what we're doing. And that will roll out in budget 2012. But the consultations for that have been going on since, well, for example, we went back in September. The consultation process has been ongoing with with Minister Clement's responsibilities as President of the Treasury Board. And he specifically is carrying that challenge to come up with $4 billion in cuts for the 2012, so we can get on to balancing our budgets and get on to everybody knows Forbes and Moody's and the OECD have indicated that Canada's #1 in the world in terms of fiscal responsibility. I mean, they say we're among the top. Now they're saying we're #1. So we want to continue that fiscal responsibility.
There's a backlog for at HRDC for EI claims. What is your government doing to help speed up that process for families that need to get their claims quickly?
Well, I think they're again making the EI system more efficient. There was also a backlog with respect to a difficulty security checks, which I'm proud to say our office was directly involved in creating a solution. We went to Minister Taves and he has advised, I think you saw evidence of that last night, the North Bay City Police have adopted a system that electronically transmits fingerprints. So instead of a delay of 3 or 4 months, you get a delay of 3 or 4 days. And it's been unfortunate because these people, we've had several, we've had about a number of people in our office. When I brought it to Minister Taves' attention, they get caught up in this problem where they're accused through no fault of their own, because they've got the same birthday or because they've got the similar characteristics. They got caught up in this fingerprint process. It's called security checks, and they unfortunately, they can't get themselves another job or another vocation until they get cleared, and the process was taking a long time. And basically, it was a verification process that they are the people they say they are. So that's cleared up. So EI will be the same thing. We're working diligently with our people in North Bay. We want to grow the federal service in North Bay, but we want to grow it more efficiently. We've asked them to come up with ideas for us that will make EI more effective, and if they do, we will support their program and grow the service in North Bay. So overall, EI will be more efficient, and we'll grow our complement in North Bay. We're working on that. We've been working on that for a couple months.
I can tell you, just there, it's a nightmare.
Yeah.
You know, and how do you see those efficiencies coming, and how fast can they come, and how quickly can these families or you know, these folks that are relying on an insurance plan that they've paid into see the dividends from?
Well, they're working on the problem. I can't give you a number. You're talking about bureaucracy, and bureaucracy is tough to crack, but I can tell you that we're supporting a smoothing the process, and that's the best we can do.
You don't think the cuts to Service Canada